Four of the nation's top medical experts are giving grim new warnings about the dangers of reopening the country too soon. Yesterday, Dr. Anthony Fauci and three other federal health officials testified before a Senate subcommittee about how to safely get Americans back to work and to school.
Dr. Fauci told senators that many more could die in the U.S. if states do not prepare adequately. The warning comes as a majority of states begin to reopen, with several failing to meet federal social distancing guidelines. So Nancy Cortez is joining us now on Capitol Hill to talk a little bit more about that. You know, there were a number of things that we heard from the healthcare professionals, but I remember Dr. Fauci saying, that he thought the number of deaths that we have counted now was probably low, because he felt that there were probably people who died at home and they were never counted among the COVID-19 deaths. And he also felt that as we lift restrictions, we can expect a spike in deaths. It's a matter of whether or not we are prepared to handle that. Right. Are lawmakers concerned about the push to reopen and what the result might be?
I think a lot of lawmakers are concerned, and certainly Fauci put it in black and white for them yesterday. Look, these federal guidelines exist for a reason. They say that states should not begin reopening until the rate of infection in their area has decreased for 14 days. And essentially, that is not the case anywhere. We've seen it hold steady in a lot of places, maybe dip down, back up again, but that trend that you want to see of 2 weeks just doesn't exist in most of the states that have gone ahead and decided to ease restrictions anyway. So yes, there is concern. It was heightened after Fauci put it in such stark terms yesterday, but there's also some pushback from primarily Republican lawmakers who say, yes, there are risks, but there are also risks if we allow the economy to lay dormant for too long, and more and more people find themselves out of work, unable to pay their bills. They argued that states are just going to have to get better at contact tracing and testing in a hurry, because there just isn't enough money in the federal government's coffers to continue to pay for everyone to stay at home.
You know, Nancy, there was a really telling moment yesterday with Senator Rand Paul and Dr. Fauci. At one point, Senator Paul said, that we should end the doom and gloom, he called it. And he said that while he respects Dr. Fauci, he doesn't think that he's the end-all, be-all. And Dr. Fauci sort of responded to that by saying, I've never said I'm the end-all, be-all. I don't give advice about economic things. I give advice around health, around public health. And the reason I bring this up, Nancy, is because Senator Lindsey Graham has called Dr. Fauci the gold standard. And in response to what we saw on the Hill yesterday, Liz Cheney tweeted this: Dr. Fauci is one of the finest public servants we have ever had. He is not partisan. His only interest is saving lives. We need his expertise and his judgment to defeat this virus. All Americans should be thanking him every day. The question, of course, becomes, which of these lawmakers is the president listening to? Is he listening to folks like Liz Cheney and Lindsey Graham, or is he listening to Rand Paul and the pundits on Fox News?
I think depending on the day, he's listening to either or both, frankly. I think that Republicans like Liz Cheney, like Lindsey Graham, know that the president respects Anthony Fauci and that he does listen to him. Not that he always agrees with him, but he does take that information in, and they don't want to do anything to jeopardize Fauci's position vis-a-vis the president of the United States. So I think that was an important show of support from some individuals who are also many times allies of the president of the United States. But certainly that viewpoint that you heard coming from Rand Paul, he's not the only person who has expressed that. It was interesting coming from him. He's a medical doctor, to hear him say, well, there are a lot of experts who say there won't be a surge in the fall. I wondered where he had gotten that, because frankly, that's not what you're hearing from most experts. Frankly, most of them, like Fauci, say, we don't know for sure, but if you look at the data, it certainly indicates that it's likely. And you have to, in this environment where so much is unknown, you're going to have to get a little comfortable with the fact that we don't know everything, and you have to prepare for the worst. That was Fauci's argument yesterday.
So House Speaker Nancy Pelosi revealed a coronavirus relief bill. It's a $3 trillion coronavirus relief bill, so pretty hefty price tag. You spoke to Senate Majority Leader Mitch McConnell about the possibility of that bill moving forward. I want to play a little of that sound.
We're taking a look at what we've already done. We've added about $3 trillion to the national debt and assessing the effectiveness of that before deciding to go forward. I'm in discussion, we all are, with the administration. If we reach a decision along with the administration to move to another phase, that'll be the time to interact with the Democrats.
So I don't think any lawmaker would disagree that, moving forward, more assistance is needed for individuals, for small businesses, for government, state governments that are missing out on a lot of money. Were there particular parts of the bill that Mitch McConnell took issue with?
I asked him about that. I sort of put different provisions in front of him and said, well, what do you think about sending more money to the states, about $1 trillion more to the states? What do you think about another round of direct payments to American families up to $6,000? That's also in the bill. Or hazard pay for essential workers, or more food assistance. These are all big ticket items in the bill. And he really wouldn't bite on any of those provisions. He simply said that now is not the time to negotiate. He's going to be talking this over with the White House, and he certainly was signaling that he isn't in any hurry to negotiate with Nancy Pelosi. So you're going to have a very interesting dynamic here where the House, Democrats can pass this bill on their own if they all stick together, and they can do it as early as this Friday. And then you're going to have this huge $3 trillion bill landing with a thud on the Senate Majority Leader's desk. It's going to be out there. House Democrats will be arguing, and Senate Democrats alike will be arguing that the American people are hurting and that they need this money. There's also money in there for the Postal Service. There is money in there for, to explore a vote by mail process, more money in there for testing. They're going to argue that all of these things are needed, and Republicans are going to be in a delicate position of not saying, no, it's not needed, but let's take our time. Let's see where the need is. That's the argument that they've been making. And, what some lawmakers told me yesterday on the Republican side is all the money hasn't even gone out the door yet from the first round of stimulus to state and local governments. So let's wait. Let's see how they use it. Lindsey Graham called it an audit. Let's audit how the states are using that money, make sure that they're using it correctly before we send another up to $1 trillion out the door for state and local governments alone.
Looking ahead, Nancy, tomorrow vaccine expert Dr. Rick Bright will testify before a House subcommittee. The hearing is set to take a closer look at the whistleblower complaint he filed against the Department of Health and Human Services. What are you expecting tomorrow to hear from lawmakers?
So that's going to be a fascinating hearing. It is happening in a House subcommittee, even though the House hasn't officially returned to Washington yet. He is the sole witness on his panel, and he is basically going to lay out his case that we've already been able to read about in a whistleblower report that he filed, that he says that he was retaliated against, removed from his position as the head of BARDA, which is the government organization that deals with new vaccines, because he wouldn't embrace some of these untested cures, so-called cures or treatments for coronavirus that the president was touting, notably hydroxychloroquine, which has, subsequent studies have gone on to show that it doesn't really do anything to help people with coronavirus. Dr. Bright claims that because he wouldn't embrace those drugs, because he was insisting that any money going to his organization be put into proven, vetted treatments, that he was removed and that he was put in a lesser position at NIH, which he has continued to refuse to take. He still wants his old job back. So we'll hear, Democrats will want to tease that whole story out from him. We've seen some of it in an interview with Norah O'Donnell already, with more of it to air on 60 Minutes this weekend. But you're going to have Republicans, and this will be interesting. HHS, the umbrella agency under which BARDA, his organization, is housed, they're saying that they're going to put out something of a prebuttal either today or tomorrow, basically challenging Bright's claims. They have argued all along that he's mischaracterizing what happened, that they see it very differently, and I assume that you'll have some Republicans who pick up on those threads and push Bright to explain whether he's exaggerating. They'll ask him about some of these reports that indicate that he didn't get along with everybody who worked under him, questions about his leadership, that kind of thing. So it is sure to be a sort of must-see TV, and it obviously has big implications for the way that health officials in this country have been carrying out, enormous sums of money. What are they doing with the money? How are they handling it? Are they working well together? Are they putting that money into proven treatments or the president's whims? All of those questions are going to come up in this hearing tomorrow.
Yeah, it's bound to be really interesting, Nancy. Thank you so much.
You're welcome.
So if you think the hearing is going to be super interesting, you are in luck, because we will be covering it here on CBSN tomorrow morning at 9:30 a.m. Eastern is when our coverage begins, coverage and analysis, and then we'll go into the hearing for you. We are also keeping an eye on Capitol Hill. So it's a briefing this afternoon. The House Coronavirus Subcommittee briefing will focus on reopening the economy. Health experts, including former FDA Commissioner Scott Gottlieb, are expected to testify. That's going to begin at 3 p.m. Eastern, so tune in for that.